this lecture about ECG basic. Today we'll talk about the P wave morphology and abnormality. The P wave on the ECG represents the atrial depolarization. The atrial depolarization wave originates in the SE node, sinoatrial node, at the right atrium. Then this spreads to the right atrium and then to the left atrium. So if we divide the P wave, the first half would be the right atrial depolarization and the second half would be the left atrial depolarization, and the P wave is the fusion of both the right atrial and left atrial depolarization. Normally P wave in lead 2 is positive monophasic. Like you see here in this example, the P wave is positive monophasic. This is in lead 2, and the P wave also width should be less than 120 milliseconds. Horizontally should be less than 3 small squares, and in amplitude it should be less than 2.5 small squares. And regarding P wave morphology in V1 and V2, it should be biphasic, with the first half is positive, and this represents the right atrial depolarization, and the second half of the P wave is negative, and this represents the left atrial depolarization. And the amplitude of P wave in V1 and V2 should be less than 1.5 small squares. So to comment on the P wave, first you need to look at lead 2 or V1. If the P wave is present and it's coming at regular intervals, this means that it is a sinus rhythm. Then we calculate the heart rate. If the heart rate is 55 to 100, so it will be normal sinus rhythm. Then we will comment on the P wave morphology. Either it's normal or having some abnormality, like we will see. An example of abnormal P wave morphology is right atrial enlargement or right atrial abnormality. The right atrial depolarization in this takes longer time, so this extends to and fuse with, augmenting the amplitude of the second half of the P wave, and this makes the P wave amplitude higher than the 2.5 millimeter. And as an example, in this strip of lead 2, to comment on the P wave, the P wave is present and is coming at regular intervals, so it's sinus rhythm, and the heart rate in this example is more than 100, so it's sinus tachycardia. And to comment on the amplitude of the P wave, we will see that P wave amplitude is around 3.5 small squares, so it's representing right atrial abnormality. And here is another example of right atrial abnormality. Here on the left side, this is lead 2. To comment on P wave is present and it's coming at regular intervals, so it's sinus rhythm. And the amplitude of P wave is about 3.5 or 4 even small squares. It's more than 2.5 small squares in lead 2, so it's represent right atrial abnormality. And on the right of the screen here is V1. The shape of P wave in right atrial enlargement in V1, that its amplitude would be more than 1.5 small squares and become more dominant positive, and this is the shape here in V1, like you see, of P wave in right atrial abnormality. Regarding the conditions associated with right atrial abnormality, most commonly pulmonary hypertension, then COPD, then tricuspid valve stenosis regurgitation, then pulmonary stenosis, then tetralogy-followed atrial septal defect, right ventricular failure, and may occur with something physiological like athlete's heart. The old name was B. pulmonale, but it's better now to name it right atrial abnormality or right atrial enlargement, as not always there is lung condition or lung pathology. It's better to name it right atrial abnormality or right atrial enlargement. The other example of abnormal P-wave morphology is left atrial enlargement and left atrial abnormality. In this, the right atrial depolarization occurs normally. Then the left atrial depolarization takes longer time. So the duration of the B wave will be more prolonged, and the B wave duration and width will be more than 120 milliseconds and more than 3 small squares, plus or minus occurring notching of the B wave in lead 2. While in V1 the B wave will be more dominant negative and will be widened in duration also. Here is another example, shows abnormal B wave in lead 2 with widening of the B wave more than 3 small squares with notching of the B wave in lead 2, and in V1 B wave is widened and more negative, and this represents left atrial abnormality. Regarding the conditions associated with left atrial abnormality and enlargement, most commonly is mitral valve stenosis and mitral valve regurgitation, left ventricular hypertrophy, left ventricular diastolic dysfunction, and left ventricular systolic failure. Also aortic stenosis, and it may occur with athlete's heart. It was commonly seen with mitral valve disease, so the old name was B mitral, but it occurs with many other conditions, so it's better to name it left atrial abnormality or left atrial enlargement rather than naming it B mitral. So remember that in left atrial abnormality, the B wave in lead 2 would be more broad and sometimes notched more than 120 milliseconds in lead 2, and in V1 the B wave will be more dominant negative and more widened, while in right atrial hypertrophy or right atrial abnormality the B wave in lead 2 is peaked, the amplitude is more than 2.5 millimeter, and in V1 it will be more dominant positive and the amplitude more than 1.5 millimeter. Sometimes there is biatrial dilatation, and there is a combination of both of these. So again, this how to comment on the B wave on the ECG. First look at lead 2 and V1 and see is B wave is present and coming at regular intervals, so it is sinus rhythm. Then we will calculate the heart rate. If the heart rate between 55 and 100, so it is normal sinus rhythm. If it is more than 100, so it's sinus tachycardia. If it is less than 55, so it is sinus bradycardia. Then we will comment on the B wave morphology. Either it is normal morphology or showing characteristics of right atrial abnormality or left atrial abnormality, or both right atrial abnormality and left atrial abnormality by atrial dilatation. And I hope this lecture gave you some information on how to comment on the B wave in the ECG, and I hope it helped you inshallah in the future.